All right, so today's last clinical day was July 29th, 2021, and my unit today was 8C2, which was surgical trauma. My assessment was on a 55-year-old female who came in from a really bad fall and had multiple lower extremity wounds. So she had an open wound on her left, the inside of, or the medial left ankle. She had a large one on her right anterior knee, as well as one on the right posterior knee. She was also showing signs of a bladder infection, as well as she had a pressure injury. Let's see. Her past medical history, she is morbidly obese. However, she has been losing weight since she has been admitted due to her change in her diet. She has diabetes mellitus, type 2, hypertension, asthma, liver cirrhosis, and she's had history of arrhythmias and abdominal lymphoma. So her current medical diagnosis was the open leg wounds. She had on the large one on the right anterior knee, she had the vacuum therapy going for that, but basic dressings on the posterior knee and the left ankle. And then she had a dressing on her pressure injury. Let's see. Her vital signs were relatively in normal range. Her temp was 98.2. Heart rate was 88, respiratory rate 16, O2 stat was 99% on room air, but her blood pressure was 122/42, and her glucose was high. It was taken earlier in the morning, and it was 163, and then after she had eaten, we recorded it, and it was 133. The pain she was reporting was the pain in her pressure injury, which was on her coccyx region. It was intermittent pain. It only agitated when she would move or if we repositioned her in bed, which we did every 2 hours. She was very sensitive. It was an achy, throbby pain. The medication that she was given was helping it feel better, as well as the dressing changes, even though during the dressing change it was not pleasant. And she originally had ranked it an 8 out of 10, and then afterwards, after medication, she would rank it a 5 or 6 out of 10. Let's see. She didn't have a bowel movement today. Her last one was recorded on the 26th, so about 3 days. She was voiding though, which was good. We had changed her linens. And she was high fall risk. She didn't get out of bed at all today. So the problem list, I had written down open leg wounds, her liver cirrhosis secondary to NASH, and her pressure injury. I wrote down the liver cirrhosis because she also had ascites in her abdomen. It was really protruded, which could have been causing the bladder infection as well. And then for the nursing diagnosis, I wrote impaired skin integrity. So the state in which the skin of an individual is altered unfavorably, related to the lower extremity wounds and the increased need for nutrients, as evidenced by the stage 4 pressure ulcer, throbbing, aching pain, and delayed wound healing. So for short-term planning, I wrote pain control, so that the patient will experience decline in pain level from 8 out of 10 to 6 out of 10 within 1 hour of dressing change and a meds from R. And then for interventions, we repositioned her every 2 hours. We performed wound care on all of her wounds or dressing changes. We administered her medication. as well as continuing her diet and giving her multivitamins, vitamin C and zinc to promote her wound healing. And within an hour, she did report a lesser pain level, about a 5 or a 6 out of 10, which was good. And then for long-term planning, I wrote nutrition education for proper wound healing, so that when she is discharged either to a nursing facility, I believe is what they were planning on discharging her to, since how bad her fall was, or if she was going to live on her own, she could have found better ways to cook and healthier meals to help with her weight and her diabetes and preventing falling again. And that's it.